Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Well, welcome everyone. This is episode 26 and we're going to be talking about just some hints on how to get pregnant, which is really important.
Yeah. Stuff you have to do to get in the space.
In the space, yeah. So we're not really going to cover, ovulation and things like that. That was episode 2, our how to track your ovulation like a ninja. So go back and have a little listen to that. But this is going to be fun, and you'll definitely have some tips by the end of it. And Patty, though, we wanted to tell everyone we've had another family here who you've delivered now their fourth
baby. And
guess what it was, boy? Give it away.
And fourth boy.
Yes.
So they're the same as us, 4 boys.
And she didn't find out the gender of the baby either, did she?
No. So it was just I shared the story of when we took the kids to Disneyland, and one of our kids said, "It's great us all being boys. We don't have to go on any stupid girl rides."
That's probably one big benefit.
I told her that story. There's lots of benefits to single-sex family.
Yes. You can hand down the clothes.
Hand down the clothes.
Yeah. What are the others? I'm struggling.
So anyway, it was a happy day.
And did they have a name for that baby?
Mick.
Mick. Oh, cute.
Isn't that nice, Mick?
Yeah.
And so I got a brother, Mick. It was great, and she's one of the, I think maybe the first or equal first number of babies from one woman. That I've been involved in the care of. So all 4.
We don't have many 4-child families anymore, do we?
No, and I don't know if that record's going to be broken anytime soon because there certainly aren't many 5s.
Yeah. No. All right. Well, so we're going to go on to how to get pregnant. So this is all sort of stemmed from, at the moment, this week we've sort of been covering off on a couple of posts on our Instagram, which people, if you're not there, please go over right now, drop your listening and get onto your phone and just go to our Instagram and come and be one of our friends. And we've been covering getting pregnant, and we've been talking a lot about what a regular period is. Mm-hmm. And somebody asked the question, I think might be worthwhile sort of answering it here. We'll answer it also on Instagram, but her question, Mel asks, does regular mean bang on the same number of days each cycle, or around about give or take a few days for each cycle?
Well, bang on's nice. That kind of proves it. If you have a 28-day cycle and it's every 28 days without fail, that's an ovulatory cycle. You're ovulating.
Yeah.
And it really needs very little confirmation of that.
Yeah.
But if there's significant irregularity, that's probably not ovulating, or not ovulating when you think you are, or not ovulating every month.
Right.
And then there are women who have some mild cycle irregularity, perhaps a day or 2 out.
Yeah.
And they're probably ovulating as well.
Yeah.
But if they're having trouble, checking for that ovulation is easiest. A blood test done on day 21 of the cycle looking for progesterone levels.
Yeah. And
if the ovary's already made an egg, the progesterone level will be high.
And who does that blood test?
Oh, GP can organise that without much trouble.
Yeah.
And certainly one of the ones we look at if someone's made it all the way to a obstetrician gynecologist or infertility specialist.
Yeah.
But it's a nice little place to start, especially if someone thinks, well, my cycle is somewhere between 26 and 29 days.
Yeah. Am
I ovulating? Well, that's the way to find out.
Yeah, right. Okay. And, how would they do that straight away? Like, oh, gosh, I loved it. One person sort of said, I don't have it in front of me, but one person said one of our posts was, there's the normal time. So if you're got a regular period, you've been having well-timed sex, your partner has no history or problems with semen quality, then it's 12 months is kind of like an average time to get pregnant if you're under 35.
Yeah, well, that's how long you should try for before seeking help if everything else is ducks in a row.
Yeah.
Yeah.
And she said that she had an irregular period and she sort of questioned whether she should have gone as soon as she did, but she's so glad she did. She went straight off to the GP before they sort of started because she realised that irregular periods is one catalyst to go and see a GP.
To go earlier.
Yeah, to go earlier. Don't wait the 12 months.
Yeah. And did she learn that from us?
No. She damn it. But she confirmed that that was her story and that was good. Yeah.
Yeah. So it's a kind of a thing of mine that there's no point trying for 12 months if you don't have the ingredients.
Yeah.
And so what I hope some people get out of our podcast is if you've got shock and pelvic pain, irregular periods, a partner who's had mumps and a varicocele, varicose vein in his scrotum, and you're both in your late 30s, we do not wait a year, people.
Yeah, just get along.
We get along, get stuff tested, make sure we've got the right ingredients to start with.
Because to be honest, most people, well, not most, but there's so many of us included, who find their partner in their 30s, and then they sort of wait until the right time in that relationship to have a child, and that could be that they're 34, 35, 36, 37, or us, 39, 40.
So there's nothing wrong with that, but we want to be just a little bit more scientific about it.
Yeah, yeah. We were perhaps too scientific. We thought we would have struggled to get pregnant, and here we are. Good. All right. So, Patty, we wanted to start off, and it's not something medical. This, getting pregnant, we say the first thing that you need to do is just take stock. Where are you at in your life? Obviously, the decision to become a parent is a big deal.
Yeah, so I think one of the things we do is we all make great plans for the birth of the baby, but ultimately looking back, that's kind of one day in a lifetime of parenting, and it doesn't stop. They get big, and all my brothers and sisters are all in our 40s, and my mum would say she's still parenting to some degree.
Oh, wow, is she still parenting? and she needs to.
So in a lifetime of parenting, the birth is one day. It's a big deal, but it's one day. And I think, during that time of trying, it's the perfect time to think, what do we want to achieve here?
Yeah.
Which of my heartfelt personal values do I most wish to foster in my child?
Yeah.
What sort of a parent am I going to be?
Yeah.
Yeah.
And also sort of what support have I got? How do I think I'll cope? How do I think I'll be able to tap into, family help, friends help, because we say it again and again, it really does take a village, and we see it in our clinic because we're based in regional Victoria, and we have a lot of people that perhaps move here and they don't have that support base, and it's a very hard road for some of them.
Yeah. So in this, if we're fortunate enough to have a pregnancy where it's planned and we're getting all of those ducks in a row on some folate and off the contraception, charting the cycle, then there's time, right, to think about some of those issues, like why we're doing this and how we're going to go about it.
Yeah. And this is by any means telling you not to do it. Do it. We love babies.
Especially it's the best thing you'll ever do.
Yeah.
That's just. It's something to think about.
Exactly. So we also think that it's just vital to get educated.
Yeah, that's what we're doing here.
Yeah. So,
that's what this is.
Big tick to you. You're already here. You're already learning about things. Oh, my gosh, there's so many medical terms in there. It's just like you've started a whole new course that you don't have a platform to learn from. Or do you?
Yeah.
That's why we're building the Grow My Baby program. But, you will get bombarded with terms and you'll think, my God, this is just like a whole new world. So, yeah. Really.
And sometimes there are things that people, it's not until their second or third baby they think, I didn't realise that was an option.
Yes. Oh, yeah.
And you're just like, it was always an option. It's just you didn't know about it.
Yes.
So there are, things, delayed cord clamping.
Yeah.
That's
Maternal assisted cesareans.
Yeah. So something, delayed cord clamping's gone from very quickly from a sort of a strange thing that people wanted to do for a little bit fringe, right up to absolutely standard.
Yeah.
In just a few years.
Yeah.
Because it turns out it's good for you.
Yeah.
And it turns out that it's reasonable to do at most vaginal births and even at most caesarean sections.
Yes. Yeah.
I've had people say to me, I couldn't have that because it was a section. I'm like, why not?
Why not?
That's it. That's fine.
Yeah.
If you're not bleeding, of course we can wait.
Yeah, exactly. Skin-to-skin contact. These are things that sometimes it happens in a hospital, like even between the 4 boys.
Yeah.
I think the only real skin-to-skin contact that I had was our third for Solly, and they just, it was, I didn't even have to ask for it. It was just sort of done. And then for Rex, so he was our fourth, he was all wrapped up like a burrito and given back to me. So we didn't really have that immediate skin-to-skin contact until the next midwife came. I just forgot to ask. And the next midwife came and said, oh, well, that's not good. She unwrapped him.
So there you go. That's a good example because we can't always rely on the hospitals and caregivers to magically give us what we want.
Yeah.
We want to ask for it.
Yeah.
And you won't know to ask for it unless you know what's available.
Yeah.
What are the things you get a choice in?
Yes.
And how do we go about exercising that choice?
And that's it just reminds me that we've written this really good fillable birth plan template in our Grow My Baby program. So, all of those things are sort of covered and you get that, you get the trigger to even think about, well, do I want delayed cord clamping? Do I want skin-to-skin contact?
Yep.
We think yes should be the answer to all those things.
Want to feel good more often in 2026? Hi, we're here for you. Move by Mamma Mia helps you fit movement into your everyday, giving you more of me time whenever you need it. From strength and cardio to yoga and Pilates, with workout plans that fit every space, every body, and whether you've got 10 minutes or 40. Start 2026 with enjoyable movement from just $9.99 a month. Mamma Mia subscribers get unlimited access. Head to move.mamamia.com.au and use MoveMe to get $20 off an annual subscription.
So the next ones we want to talk about in terms of getting pregnant is, getting you into good nick. So it's really vitally important, isn't it, Pat?
Yeah, so we're talking about exercise and it doesn't matter what you do.
Yeah.
Is the bottom line. You have to do something.
Yeah.
So even if your body weight's normal, you still want to be doing some exercise regularly.
Yeah.
And come on, if you've got no kids yet, what else are you doing with your time? so
watching Netflix. Oh my God, what did we do with our kids? Oh.
So you've got to just do something.
Yeah.
And commit to it, so that cardiovascular health and body weight are under control when the pregnancy starts.
It's a habit,
Yeah. And that you're in the habit of exercising, because you've got to keep going in the pregnancy.
Yeah.
You're a few weeks off at the start when you feel really bad and with the nausea and vomiting, and then you've got to keep exercising so that we can manage the manageable risks of hypertension, preeclampsia, and diabetes by keeping body weight under control. So you want to be doing something in early pregnancy, and that might be the thing you're already doing. Yeah. If it's something that's suitable for pregnancy, which most things are. Yeah. I just say to people, contact sports out from when you're pregnant. Yeah. That's about it. And then in the third trimester, you move on to something pregnancy specific, like Pilates or yoga or water aerobics. Yeah. But it's about a philosophy of being active.
And I think it's about 150 minutes of moderate exercise in a week, or is it 60 or 90 minutes of strenuous exercise? So it's not much.
Yes, spread over a few goes.
Yeah.
It's doable.
Yeah.
Yeah.
Excellent. Smoking. There's Australia. Sorry, folks who are listening from we know that you're listening from the US, from Brazil. We've had comments from people from Ireland. I don't know your rates of smoking, but in Australia, we're about 14% of all of Australians still smoke, which is good. It's way down from what it was in the 80s.
Yep, 70s, yeah.
70s, but it's still 14%. And in our hometown, Pat, we're still up at around 20 to 30%. Too many people.
Yeah.
But it's a good time to stop, isn't it?
Well, that's a motivated time to stop, isn't
Yeah.
it? So it's a time when you can really think, well, this is not just me, got a baby, and it's either going to help me get pregnant or help me have a healthy pregnancy if I'm already pregnant. If we stop the smokes, and then it's been shown time again that if your partner stops as well, and you motivate each other.
Yeah.
That the quit rate's more sustained.
And for your partner, there is some studies that sort of suggest that it does impact on semen quality, smoking.
Yeah.
And what about for the woman though? Why do we want them to stop smoking?
Look, there's a number of reasons. So overall fertility rates are lower. There's a number of ways in which smoking decreases fertility. But then once you're pregnant, smokers, heavy smokers, you can make a problematic placenta.
Right.
So just like if you're a smoker, it can affect the quality of small blood vessels in our body.
Yeah.
So that's why it can give you a heart attack. That's why it can give you a stroke, because it can block small blood vessels. Well, a heavy smoker who's pregnant, the placenta is nothing but blood vessels.
Yep.
So
Okay.
it affects it in broad terms in the same way.
Yeah, right.
So if in those early months the placenta hasn't formed properly, then in the later months of the pregnancy, you just start to see significant problems with growth restriction.
Yeah.
And higher rates of major complications.
Okay. And if that little talk about smoking is at all motivated you, the Quit organisation has some really great tools to help you. So that's quit.org.au.
Yep. And they've got some pregnancy-specific stuff.
Yeah, good. The next thing we want you to do is to go to your dentist. You're trying to get pregnant.
Yep.
Now's the time.
Yeah, ideally beforehand.
Yeah.
And certainly once you're pregnant if you haven't been yet. So I get a lot of phone calls from people saying, I've got some toothache, I need to go to the dentist. Is it safe to go in pregnancy?
Yeah.
And I always say, for God's sake, yes, go, because it's actually much more dangerous to not go.
Yeah.
So infections that get in through holes in your teeth are an important cause of premature labour.
Yeah, right.
And so ideally go before you're pregnant.
Yeah.
And get the teeth as good as we can.
Yep.
And if you need dental work in the pregnancy, it's safe. If the dentist is ever worried about drugs they're using or x-rays they might want to use or anything like that, they'll call.
Yeah. And you could tell them, my obstetrician or my healthcare provider has said to call if you've got any questions.
Yeah. Because it's riskier to have bad teeth than to have dental work.
Yeah. The next thing that we wanted to talk about is weight, and it can go either way, can't it, for your optimal weight for fertility?
Yeah. So in our community, too high is much more common than too low.
Yeah.
To ovulate, you want to be in a healthy range.
Yeah.
But not too low and not too high.
Yeah, and we do talk about optimal BMI.
So in my, when I'm looking after pregnant women, I've got a set of scales there somewhere, but I don't use them terribly often.
Yeah.
In the old days, they used to weigh the pregnant women to see where the baby was growing.
Oh, right.
And it didn't.
No.
The only
my tummy was growing, I think, but that was the magnums in the first pregnancy.
Yeah. So
you had anything to do with the baby.
Yeah, it was one of those old things that was just part of going to antenatal clinic.
Yeah.
And the only problem is it didn't work. So it actually was a pretty bad indicator of whether the baby was growing or not. But this is before ultrasound was invented. Yeah. So there's still a role for weighing women in pregnancy, but I must say I tend to only weigh the women who are off the scale big or off the scale small.
Right.
And it's not about using it as a test for the baby growing, because it doesn't work very well for that at all. It's just about keeping an eye on the development of possible complications related to weight problems.
Yeah. Good-o. All right. So, one thing that we struggled with actually was names.
Yeah,
it's hard, isn't it?
Yeah.
Yeah. I know this is a bit lighthearted, but that's part of the fun of getting pregnant is thinking about, well, one day I'm going to have a baby and what's that baby going to be called? And then you think about it before you get pregnant, then you think about it during pregnancy, and then it comes closer to the time where you actually are having the baby, and it's panic stations.
And they're out.
What am I going to call this baby? So there's a lot of pressure on that.
Yeah, there is. And if you're going to give a nod to someone in the family, there might be pressure to give a nod to somebody else in the family. And so all of those things have to be thought through.
And oh my gosh, I remember the kids were watching a really great episode of Friends, and Rachel and Ross were vetoing each other's
you got to veto.
choices.
Yeah. No, that's the other thing. You got to agree with your partner.
Yeah.
So it has to be something. It might be neither of your first choice. It might be a compromise of second choice that's agreeable to both.
That's a massive bonus, actually, of now having teenagers in the house. Just to digress a little bit, is we get to watch all those shows that we used to watch in our 20s.
Watch them
They're
again.
all back.
Yep.
Friends. How I Met Your Mother.
Yeah. So if you're struggling to come up with a name for a boy, Patrick is a timeless classic.
It is a timeless classic. I totally agree.
If you knock yourselves out, enjoy it, and feel free to use it.
Yeah, and Brigid. Although, can I say don't call your child Brigid? No, call your child Brigid if that's what you want to do, but the amount of times I have to spell my name.
Oh, yeah.
Now, the next one, in this getting pregnant phase is to really talk about your choices around where you want to have the baby.
Yep.
So in Australia, we are absolutely spoilt for choice. So we can have a private obstetrician in a private hospital, obstetrician in a public hospital. We can have a private obstetrician and you just pay your cold hard cash. We have midwifery care in a public hospital. We have obstetric care in a public hospital, private midwife, doula, home birth.
Yeah.
There's a massive big gamut.
Yep.
And it's really confusing.
Yep. So we have to work out what is right for you.
Yep.
And have a think, about that. Maybe discuss that with people who already know you, like your family doctor.
Yeah.
And work out what you think the model that is right for you. And the things that I feel very strongly about as an obstetrician is that regardless of which model we go in for, there should be at least one visit with a doctor who's an expert in obstetrics in your pregnancy.
Yeah.
Even if it's only one, to take a detailed history and to say, yep, you genuinely are low risk.
Yeah.
And you might see a midwife from then on right through.
Yep.
And in fact, that's a very popular model of care here in our hospital.
Yeah.
No problem with that at all, but there's very good data that suggests that a single appointment with a doctor who's an expert in obstetrics during your pregnancy is a really good idea.
And that happens at about 20 weeks in the public system, does it?
Yep. So ideally, if we're having someone come into the public system and they're having a booking visit, that we cast an expert eye over them at that first visit. I identify the people who are super low risk and suitable for a very low intervention model of care. And then from that point onwards, the people who are going to have all their care through the hospital might go to a clinic run chiefly by midwives. They might go to a clinic run by junior medical people, or perhaps a great option as well is they just see their GP.
Yeah. I forgot that as a model of care. GP.
In a model called shared care.
Yeah.
So you've got a family doctor with an interest in obstetrics. Maybe in their medical past they were a hospital doctor at some point, developed some expertise in obstetrics and continued to provide antenatal care out in the community without actually doing deliveries.
Yeah.
And then, so you see the family doc, they do the blood pressure, they check the baby's growth, they check the diabetes, make sure they don't have preeclampsia, baby's growing properly, and then there's a few key visits with the hospital.
Yeah.
And that helps keep healthy people progressing normally out in the community.
Yeah.
And people with problems in the hospital.
Yeah.
Yeah.
And look out whether you've got a shared bedroom or a... There are also decisions that you have to make.
Yeah.
So I just don't know whether... I remember when I was looking around, they were big in my decision making before I met Pat. So first time listeners, I met Pat when I already had 2 boys. And so for me to make decisions without, having my handy obstetrician partner to help me along the way was quite confusing. And so I get that. I get where women are when they're making these choices. But I definitely looked at hospitals where I sort of looked at how many people in the ward and, those were important. Whether in hindsight, they weren't the important parameters I should have been using to help make my decision.
Well, no, but it's something, isn't it?
It is something, yeah, that's right.
So when, one of the things that you get in Australia, if you've got private health insurance and go through a private system, is a single room in hospital. And when we ask patients what value do they see in their private health care, we as the doctors like to think it's because they get one-to-one contact with us and we're wonderful and that's why they like it. But one of the things that always scores pretty highly is a guaranteed private room with your own bathroom.
Yep. Oh, yeah. And food.
Yeah.
Although the food anywhere, that's my big bugbear. I wish that we would have really fabulous food in hospital because it's such a big part of healing.
Healthier food.
Healthier food, yeah.
Yep.
All right. So if you choose to have a private obstetrician and you are in the getting pregnant phase, so you need to have your insurance for at least 12 months. You need to up your insurance firstly to cover obstetrics.
Yep.
But you need to have it for 12 months before the birth of the baby. So
so the 9 months of the pregnancy would count.
Would count, yeah.
Because the claim is for the birth and delivery, the hospital bit.
Yeah.
But because we don't know exactly how long pregnancy is going to go for, you might go a bit early.
Yeah.
It's a good idea to up your cover to cover obstetrics 6 months before you get pregnant, so that you're very safe, fully covered when the time of the birth comes around. And we do see this a bit, unfortunately. People think I'll get around to it because it's going to take me ages to get pregnant.
Yeah.
And then they go off the pill, conceive in the first cycle.
Yes.
And are caught out with no cover.
Yeah.
Before when the birth comes.
And then, if it is that they want a private obstetrician or whatever, then they just make that decision whether they will go just to but go to the public hospital or whether they'll pay their cold hard cash.
Yeah, which is tough, isn't it?
Yeah.
Because ideally we'd have your insurance cover and it helps. It's still expensive, but it helps it helps just to take money out of the decision.
Yeah.
Quick question. Are you tired of the news? Do you want a podcast that isn't self-improvement? Come get unleashed. It's funny.
I also think that underwear is sort of almost like a new marriage. Like it starts off, it gives you the best of what it offers at the beginning.
It's unhinged.
I have a bit of a thing for my friend's husband's salami.
Oh, hello.
It's not here to teach you anything.
I need to make sure he looks at me. One side, I'm going to make a sign. This is what I married because I didn't meet you in time.
Yeah, right.
The other side, with pointing to my son who's 12, look what we could have had, Lewis.
Yeah, I love it.
It's a good time for Gen X. So search Unleashed wherever you get your podcasts. New episodes every Tuesday.
Yep. Other things that you need to be doing before you get pregnant, you need to be on folate, don't you?
Folate.
Yeah.
So folate's a vitamin, and it's a good idea to start folate supplementation when you first start trying.
Yeah.
So I just say to people, if you're on the pill and the day you stop the pill, you start the folate. So just change one pill for another. And some people start taking a pregnancy-style multivitamin. I guess if you've got a healthy diet and a normal body weight, that might be overdoing it a little bit.
Yeah.
All you really need in the pre-conception phase is folate, and that's just so that there's plenty of folate in your system right when you conceive.
Yeah.
And then I say to people, change over to the multivitamin once you're actually pregnant.
Yeah.
And folate's important. It helps prevent what's called neural tube defects, which is abnormalities of the baby's spinal cord, serious things, and we know that it's basically not really possible to get the high levels of folate that we need to prevent those things from your diet. You pretty much got to be supplemented.
Yep.
So whilst a perfect diet will give you just about everything else, you need the pill to get enough folate.
Yeah. All right. We will talk about charting your cycle. Like that is definitely part of getting pregnant, isn't it?
Yeah. So we've got to listen to episode 2 about Ovulation Ninja because that's the thing that we see people have got wrong all the time.
Yeah.
And not knowing enough about the fertile time in their cycle.
Yeah.
So when they come to see us after a year of trying, a lot of that year hasn't counted because they've had the days wrong.
And how sort of soul destroying. You know, they think that they've been doing the right thing, they've waited their 12 months or whatever, and we find out that they haven't been having well-timed sex. Or
for want of a little bit of pregnancy literacy. Yeah. So super important. Yeah.
Yep. And the last thing, I'm sure there's much more we could be talking about, but the last thing on our list today is to see your local doctor.
Yes. This is the other big thing, passion of mine about this issue.
I'm sure if you've been listening to our podcast for a little while now, you've heard Pat say this again, but say it again, Pat.
Look, the local doc is such a terrific resource, and I think probably globally we see the doctor as someone you go to when you're sick.
Yeah.
But there's another way of looking at it, and this is doctor is someone you go to help me stay well.
Yeah.
So if we're trying for a pregnancy, the local doc's in a really good position to do some teaching on how to get where we want to go.
Yeah.
So not only can the local doc say, well, did you know that the ovulation happens in the middle of the cycle and you should be timing intercourse around the middle of the cycle? Or, you've seem to have tons of pelvic pain. Shouldn't we look into that first?
Yeah.
But the local doc's also the expert on maximising the state of control of any other health problems that you've already got.
Yeah.
So if you've already got insulin-dependent diabetes since you were a 5-year-old, we want that to be in the best nick possible when you conceive. Lots of diseases get worse in pregnancy, and some of them have a negative effect on the pregnancy. So we want to be under control.
Yeah, and if you're taking medication, or
absolutely.
All of that needs to be reviewed.
Yep.
Yeah.
Yep. So a local doc is a terrific resource for that. And I would say that anybody with an existing diagnosis, from your nose to your toes, should have that reviewed before getting pregnant.
Yep. We don't actually have it on our list, but I'm just thinking about my first time of getting pregnant. What about alcohol? What if I'm trying to get pregnant? What am I doing with alcohol?
Yeah, well, we should be drinking less than we usually do.
Yeah.
So absolutely, again, local doc, great source of information. But winding that back significantly. Some people in the wanting a baby years are also in the don't have any kids yet years, so alcohol intake might be high. Yeah.
Alcohol intake for some in the baby years is high too.
Well, that's, we laugh, but
I know.
It's
the mummy 1 o'clock thing. I don't know how I feel about that. Like, you see so much on Instagram where it's like, is it 1 o'clock yet?
Yeah. So I guess that's fine, but the message for pregnancy itself, of course, still has to be 0.
0 as soon as you find out you're pregnant.
Yeah. So if we reduce because we're trying, then it's going to be easier to get to nothing.
Yeah. So when we say reduce, we're sort of thinking about 1 or 2 glasses a week or something like that.
A week, yeah.
It's not much.
That might be significantly less than people are usually having.
Yeah. And also, I think there's some stats, and we're going to do a podcast soon on male fertility, but there are stats around alcohol for males as well.
Oh, yeah. And sperm motility and the quality of the semen analysis.
Yeah. So, this is a bit more sort of like an overview without sort of drilling down too much into the particulars, but we hope that you've got something from that. And come over onto Instagram and when this post comes up and just ask us your questions, see what comes up.
Would really appreciate anyone getting in touch from anywhere where you're listening, and it's always a pleasure to, to get back to you with some information or some point you towards some quality resources.
And give us a star review.
Oh yeah,
we like those. We read them all the time, and it's kind of makes us enthused and motivated to keep going because. To just get here today was a test in logistics, wasn't it, Pat?
Well, that's it was. It was. So anyway, thanks for listening, everybody. We'll see you next time.
See you now. Bye.
Hey,
Even though Dr. Pat is, well, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.